Jinxed it. I do apologise. Okay, good morning, everybody. Welcome to this live session of the Engagement and Oversight Board. We aren't going out live today, but we are being recorded, and it will be uploaded and available on the website after the meeting, or possibly during the meeting, but certainly it will be there for you to find. So thank you very much, everyone, for attending today. I'm going to go straight to the minutes from the previous meeting, which was the 25th of September. I presume that we're happy with those minutes. I'm looking around the room, nobody's raising any queries, so we'll sign those off as a good record of the meeting. Thank you very much. We come to the summary of the local surveillance data, and I'll hand over to Lucy Whiteman for that. Welcome back from your little break. Thank you for coming back. Here you are. Over to you. Thank you, Lucy.
Thank you, Councillor Morris, and apologies again for not live streaming, just some technical issues as you do get now and again. I have also got some building work happening in the background, as I have a door that doesn't lock at the moment, so apologies for any background noise. So this week's report obviously provides data up to the 20th of September. And obviously one of the key messages here is that Northampton and Corby boroughs have been removed from the Chief Medical Officer's watch list. I do obviously, however, want to express significant caution that needs to be applied when viewing this change. We do still have, significant challenge locally, particularly in Corby at the moment, but also an uptick in prevalence incidents in Northampton as well. So although we obviously are pleased that our rates have come down, and certainly compared to other areas, we have seen how the positive behaviours of the public and the increased testing has certainly started to quell what was a significant increase in recent weeks, we're not quite where we need to be in the long term, and therefore if we're to sustain this more positive position, we do need people to continue to act in the way that they have been and comply with all of the new government legislation and guidance. But if we go on to the first slide, and this is a slightly longer report, so I will go through it quite quickly. Obviously, as I said, we've talked about the fact that there's been significant change to government guidance. And again, we've provided links to all of the new government guidance. And this report, as people will remember, is available on the Northamptonshire County Council website. So please do use that. It is helpful, and it will take you through to the web pages of the government, so people can keep up to date with the ever-changing guidance and policy. So on the next slide, again, we've got a sort of summary of the position. Again, these are the key changes. We are obviously now required to much more regularly wear face coverings, working from home wherever possible. Changes certainly to our hospitality services. We've now provided the National Test and Trace app, which I'm hoping everybody has downloaded. And obviously there are greater now restrictions again to gatherings indoors. If we can go to the next slide, please. As I said, we have naturally come off of the government watch list because our rates have reduced, but as I said, they are not actually at pre-escalation rates in Corby, for example. So caution does have to be exercised when we start to communicate these messages. We can't afford for our staff, our businesses and the public to become complacent. They've demonstrated that they can step up to the challenge here, and we've been able to see the changes in our local case rates. So again, it's about maintaining this position and keeping everybody engaged with those key activities. If we can move on. So again, we continue to urge everybody to follow the additional measures that obviously large groups along with the national guidance aren't allowed. We continue to work with environmental health officers and the police to ensure that enforcement is applied wherever it's appropriate. We're obviously reminding people about face coverings and our face space and hands. Messaging continues to be very key. We're asking again and reminding recruitment agencies to try and keep workers assigned to one establishment so that the risk of cross-infection is reduced. And importantly, as schools, colleges and universities return, that obviously we continue to work with them and maintain the very high standards that they've set in their return to ensure that we keep the disruption and the cases to a minimum within those settings. So if we move down to the actual data, if that's okay, Cheryl. So in the week up to the 20th of September inclusive, there are 136 cases. So it is a slight increase on the previous week 136 cases were identified. It is a slight increase on the previous week. 11 from Pillar 1 and 125 from Pillar 2. So again, although we've had a significant surge and we've managed to reduce numbers overall, there are still areas of concern. So if we look at the next slide, which gives us a district and borough breakdown. Oh, sorry, if we can move on. We can see here that the number of cases, 136, we've still got that high concentration of cases in our most densely populated area of Northampton. But Corby, the number of cases for the size of the population there at 22 is of concern. And again, Kettering and Wellingborough with smaller populations, still quite a high case rate. So although it's a reduction on the previous week's case numbers, overall rates are still not where they need to be. If we look at the next slide, which gives us the rate per 100,000 population, we can see here that Northamptonshire overall is now lower than the England average, but that is simply because the England average has increased so significantly because there's been an overall surge in cases, particularly in the north. So although it looks like a much better position, we do have to understand the context of a significant increase in cases elsewhere in the country. Again, if you look at the case rate per 100,000, in Corby it's 28.2. You know, initially the government were escalating areas where the case rate was 20 or above. So we do need to be mindful that the thresholds for tolerance around escalation have changed, and therefore Corby may have been in a different position if this rate was actually identified a couple of weeks ago. Similarly, we would like to see Kettering's rate come down further than 22.7. So we continue to work with all of these areas to make sure that we locally are happy with the picture, even if nationally it looks comparatively better than some other areas. Move on. Again, that's the cumulative picture, so we can see that obviously we're still on an upward trajectory because this just adds our cases on week after week. The more informative picture being the next slide, which gives us the number of daily cases per borough and district. And yes, as again, you can see that we are now below the England average in all of our borough and district areas, but we've still got 3 areas that are slightly above or around the same as the Northamptonshire average. And therefore we need to make sure that we focus our efforts on those areas to keep bringing those rates down. The next slide. So from a point of view of our schools, they've not had a significant impact on those numbers. So that is not, you know, the case from a point of view of it explains some of our increases. The active school outbreaks, there's only 6 at the moment. So bearing in mind we have over 300 schools in the county, that's an exceptionally good start to the term reopening. At the moment, 100% of the schools are open, 95 of them open fully to all year groups. At the moment, we've got an 89% attendance. My understanding is that's moved up this week to 91%. Compared to the same position last year, there was an attendance of 95%. So although still lower than a normal year, we can see that obviously confidence in return to school has improved and continues to improve. So that's a really positive picture. The next slide. Again, cases by community, as we've talked about, the cases in the last 28 days are focused on Corby, Kettering and Northampton. Corby in particular, you can see here, features in a number of the sort of top 5, top 10 positions by cases by community. Next slide. Similarly, obviously, as we go from a point of view of comparing areas by population, so again, as a rate, you can still see that Corby, Central, Northampton and Kettering feature pretty much throughout the whole of the top 15. Again, in the next slide, cumulatively, we know that our cases have been focused on our more densely populated, more deprived areas. But you can see Corby starting to move up the ranking there, just simply from a point of view of recent activity. So if we skip the next slide, which is a similar picture as by rate. So outbreaks at the moment. We currently have obviously a range of features in place to identify and manage outbreaks. Care homes obviously will continue to feature because of the routine testing, but you can see that the number of cases in each area, bear in mind the number of outbreaks still remains very small, and that's because of that proactive testing. It really does help us manage and maintain particularly those asymptomatic cases. Again, our workplace outbreaks are quite steady. We haven't seen a significant increase, despite the fact that over the last few weeks, certainly people had been returning to work. Recognise that that guidance has now changed again, but that return to work didn't seem to create a significant surge in our workplace outbreaks. We continue to work with the Health and Safety Executive, Public Health England and our environmental health officers to manage those. As you can see, we've got the 6 outbreaks in schools and colleges recorded there, 1 currently in a hospital and 1 in another setting. We will see the numbers of the cases affected reduce significantly because outbreaks remain active, I should say, until 28 days after the last case was identified. So any number associated with the previous Green Corps outbreak will start to come off of our records in the next week or so. So again, a more positive picture, but only because we're making sure that everybody is helping and working together to comply. So if we go to the last couple of slides. Obviously, this just summarises the changes and the work that we've been doing, making sure that we're making businesses aware of the need to download a QR app. So there are those businesses that are required to do so, and then those that are recommended where it is obviously optional. I think the more people that are able to check into locations, the better able they are to understand what exposure they may have had to COVID, and the more likely, obviously, we are to be able to get and maintain on top of the curve locally. And the final slide, again, just gives you information about what we're asking people to do, so to continue to play their role in the fight against COVID locally, and to make sure that obviously if they've got any concerns, there is information on the previous slide about how to contact their environmental health services. But obviously we continue to work with partners, including primary care and hospitals, where we're monitoring activity very closely to make sure that we maintain this position. The good news is that while our rates are low, we are in discussion with our acute sector colleagues and also our care home colleagues about reopening visiting, obviously in a COVID secure way, but trying to make sure that we optimise the opportunity while our cases are a little bit lower, so that people can start to also get back in contact with their loved ones. There is a recognition though that that may need to change in coming weeks if we see the same escalation in cases that we have in other areas.
Thank you very much, Lucy. A very thorough summary as always. I've got one question for you at the moment from David Jones. David, good morning, sir.
Good morning. Thank you, Lucy. As always, really helpful and very encouraging, positive working together from everybody in Northamptonshire. My question is about the app. I don't know if we're going to come on to that later. Obviously, really important and helpful. But many people, I have to say, including myself, have been really shaken by the way the government has used data from social media and other places. I frankly do not trust some of the use of data in various places. I've looked at this app. I see that there is a lot of information about how the information is used and restricted. It's not to have access. But I think if the public is going to have trust in this app, this is a really crucial issue, that people are going to need to be confident that the information is used for this purpose only, that it is not shared with other places, that it is limited. The more reassurance, the better. I haven't downloaded it yet, I'm being very honest, because I want to be reassured about all of this. So, but I know it's important. So if we're going to do this, could you give me that assurance, and how can we say to the public that it is absolutely safe and that this information will never, ever be used for any purpose except this really important COVID purpose? Thank you.
Thank you, David. Lucy.
David, I completely understand. Obviously, the NHS is probably one of the most conscientious organisations with regard to information governance. Even in my clinical practice, our ability to access data has significantly changed. You are only able to access records for clinical purposes, and at the moment this doesn't have a clinical purpose. This is purely about being able to utilise the unique mobile phone sort of setting and location, and compare it to others. And then as somebody uploads details about their status, if they become positive, that triggers notification anonymously to phones that have been in close proximity, so that you're able to understand if you've been exposed, which means you've been in an area where a case has been, but you have not been a direct contact. And then obviously there is the more important direct contact notification. And the app also gives you the information about the number of days that you then need to isolate for. So it's a really, really useful tool. As I've said, the only reason that we've got on top of this is because people have actually complied with the traditional sort of pen and paper and telephone call test and trace service, both the local one and the national one. You know, that still isn't perfect. You know, I cannot pretend that it is, and nor can I pretend that the app is, but from a point of view of information governance, I have every confidence that there is going to be no government data sharing. This is purely for the purposes of making sure that people are aware of the risk that they are exposed to locally, and that they are able to upload information if they become a case, so that anybody that they may have posed a risk to is also appropriately informed.
Okay, Lucy, I've been reassured. I'll take a deep breath and say that I will download the app. But it's going to be really important that the public are reassured about this, and there's a lot of concern. So, but I'm reassured. Thank you very much.
And David, may I just make a request? Because actually, I think you raise a really important issue, and obviously Healthwatch is a very well recognised and well respected source of public information from a point of view of patient representation. So if I could ask you to work with my comms colleagues so that we can provide more detail about the data concerns, and maybe an FAQ around that, so that, again, if you're able to provide the fact that you're assured as an organisation, hopefully again that will continue to build public confidence in this app. As I said, it's not perfect from a point of view, I know people have difficulty downloading it to older phones, but from an information governance perspective, I have no concerns.
Yeah, we have had issues of older people who feel that they want to be protected, and the app doesn't work on some of the older phones, and that has really shaken people. But we've already been putting out the publicity about it. So yeah, we're very happy to do that. Thank you, Ian.
Thank you very much. And I think that would be helpful if we had something come to the board actually on that very subject. So perhaps we can add that as an item to the next public meeting, if that's not too much trouble for anybody to organise. I know everyone's very busy. I have downloaded the app, and I've used it on a number of occasions to check into venues and various other things. And actually, it's very, very user-friendly. It's very easy to use, aside from the fact that perhaps it's difficult to download for some people. But I have no doubts that it's the right thing to have, because it is vitally important that we have this app as part of the arsenal of our measures against this disease. And I have no doubts that it is being used for the right purposes, and that the data is not being shared other than where it needs to be shared, if you see what I mean. Jonathan, you wanted to come in. Hi, Jonathan.
Yes, hi. Thank you, Ian. A couple of things on the app. Agree with you. Incredibly easy. First venue I arrived at, saw the QR code.
Yeah.
I had downloaded the app and checked in within about 25 seconds, I think. It's incredibly simple, and it's very, very responsive. Just to raise a concern, which I think we have the answer to, but it may be worth airing. A couple of people have raised with me the issue that it then checks you until midnight. So, for example, if you go into a public place, a gym or something, at 8 o'clock in the morning, it says you're checked in till midnight or when it closes. My answer to them has been that their fear, therefore, if anybody throughout that whole period checks in, that they're in a pool of people who may be alerted and asked to. My answer to them is that I think the tracing service would then identify a little bit clearer that they were in at 8 till 9 and somebody else was in at 5 o'clock in the evening. But is that Lucy's nodding? Have I got that right, Lucy?
Yeah, so as Ian says, it's a very good phrase. It's one of the sort of tools in our arsenal of responses. So yes, it does. It checks you in for a period of time. You can't sort of check out. But what it does, as I said, it tells you whether you've been exposed, and then obviously Test and Trace nationally would then go through a much more rigorous process with that employer to go through all of the information that they have about people who use that QR code. You would then potentially be contacted if the National Test and Trace Service felt the risk was high, to go through a more detailed query process about, well, when did you attend the bar? If that member of staff was working all night, if it was a member of staff, for example, you may well be identified as a contact. If it's another patron, and they're able to ascertain that you were sat however far away from them, and all tables should be at least 2 meters apart, remember, anyway, it would be an exposure, and therefore you would just be told to be looking out for symptoms. You wouldn't be identified as a case. So you're right, it's an early warning sign, and it helps the contact tracers then identify the locations and the level of risk that people may have been exposed to.
Thank you.
It's really helpful.
Just anecdotally, I went, I mean, no one needs to know my movements particularly, but I went to Wagamama's in Leamington Spa for lunch yesterday, and I checked in there on the app, and of course all the social distancing measures were in place, all the distancing and everything else, and I was really reassured by that, I have to say. I might not have gone for lunch in Leamington Spa if I hadn't known that the app was perhaps looking after me in a sense, as well as the venue and all the measures that they've made. So for me, it is definitely very, very reassuring thing to have, because presumably something would have happened had there been an exposure in that restaurant. I would have been contacted fairly quickly and would be isolating or otherwise, depending on what happened. So I do urge everyone to download the app, and there will be teething problems, I'm absolutely sure of that, but they will, I'm sure, iron those out. Anyway, thank you very much for that. Thank you for your question, David. Very valid question. Let's move on now to testing update. Now, I think you're doing that as well, Lucy, are you?
I am, yes. So apologies from Sharon Wright, she was unable to join us this morning. But overall, obviously, testing nationally, we know, has been a challenge. There's been significant reduction in laboratory, well, it's not a reduction, it's just that laboratory capacity has not been adequate to manage the surge and increase in testing. And that's in part due to schools returning, but also, obviously, we've seen a significant case incidence increase in other areas. So at the moment, I've got good news in as much as we still have our 3 mobile testing units on top of our local testing site and our regional testing site. So to remind people, we've got a local testing site in Northampton, Wellingborough, Corby and Kettering, our regional testing service in Kettering at the conference centre, and at the moment our mobile testing units are currently at Nen Park, Wilton Mill and Brack Mills. And again, we've booked 3 for next week. We're hoping to maintain that position, but obviously if the demand elsewhere for areas of higher incidence pulls those MTUs again, we will only retain that one, but at the moment we have requested those 3. The number of tests done during September in Northamptonshire was 28,025. So despite some of the capacity issues, we still managed to have a reasonable number of cases, tests undertaken. Our concern is, though, that we have seen a decrease in the number of tests across all of our boroughs and districts. Now, that's likely to be a combination of both that limited laboratory capacity, which we do know impacted our availability locally, but also I think people recognising that the position is becoming slightly more positive in Northamptonshire, perhaps not going for those tests. We recognise it is now limited to people who are symptomatic only, but we do want to make sure that we do continue to encourage anybody, even with the slightest symptom, to access testing locally, and obviously to escalate to public health if they do experience any issues accessing that. Naturally, it's a nationally managed programme, but we will of course always escalate and try to find solutions locally wherever people do experience problems. So overall, a positive position. We are seeing, as I've said before, an increase in those Pillar 1 tests, so those tests done in the NHS, and that's because an increase in activity. Thankfully, the positivity rate within Pillar 1 remains low, and that's, you know, absolutely a reflection of people's conscientiousness, but also the wonderful work that all of our acute and service providers are providing, and the very safe and secure environments that they continue to maintain on our behalf. So thank you to all of our acute colleagues and all of our service providers for continuing to enable us to get those services, those really important services, back up and running.
Thank you very much, Lucy. As I bang on a bit like a stuck record, but testing is key to this whole exercise, and I think we've had very high levels, as you've alluded to, and I think that has been part of the success story in the county, certainly, and we just need to try and maintain that going forward. So I'm looking around the room, there's no questions that I can see. So it's back to you, Lucy, for contact tracing. Thank you, Lucy.
Sorry, just struggling to unmute myself. So again, good news with regard to contact tracing. Admittedly, we struggle still to get 100% accurate information come through to us, but people will remember that we very early on in these surging cases in Northampton Borough requested that we were able to set up a local contact tracing service, and that was to complement the national one. So the agreed process is that we get information about cases where they haven't been able to contact them to get details of their contacts within 24 hours. So after sort of an hour 25, we get those cases information to follow up locally. The challenge at the moment is there is a significant delay in that information coming through, and that is unfortunately a symptom of both the delay in some of the testing being processed because of that laboratory capacity, but also some challenges, I understand, from an IT perspective within the national service. So at the moment, we're not getting the data as quickly as we would hope, but when we do, we are obviously managing to follow up as many as possible. So the good news, the numbers overall, so collectively we've had 814 cases referred to us since we actually started doing the local contact tracing. In the last week, it was 154 alone. Some of those are duplicates, etc. So once we've sort of filtered through those to make sure that we don't obviously pursue people unnecessarily if they've already gone through the national system, we've had 119 cases for actioning locally, and that's about 400 overall since we started. And of those, we're managing to contact trace or complete a good proportion. So of the 400, we've managed to close 331 cases. Some people are still refusing to provide that information. And again, although we're able to follow up by providing a letter to those people locally explaining the importance of understanding who that person may have exposed to COVID, so making sure that they're able to keep their loved ones and their friends and families safe. But it also means that if those potential cases aren't informed that they've been at risk and they don't self-isolate, again, they could be contributing to the cycle that we're still seeing of our case numbers starting to increase again. So it is really important. I'd like to take the opportunity to reinforce this and ask everybody again to please engage with this process. It is the only way that we are ever going to get on top of COVID, and if we don't identify where those cases are through testing, and we don't then follow up those positive cases to identify who they may have also exposed to COVID to, we are not going to get into the position that we need to, both locally and nationally.
Thank you, Lucy. Thank you very much. Sorry, got muted there. Thank you very much, Lucy. I'm looking around the room. David Jones. Hello again, David.
Just confirming that I downloaded the app while we were talking, and it's working apparently. So I'm holding my breath, but it's good today, and it was very easy to do.
That's great news. Thank you, David.
Thank you very much. I think the more people that do that, the better, I think. Although I know millions already have, we need millions more to do it. I'm going to move on now to what will probably be a very significant piece of work, which is the flu vaccination program going forward. So I'm coming back to Lucy again for some comments on that. Thank you, Lucy.
So I'm sure people are aware the flu vaccination programme this year is quite significantly different to previous years. So the government obviously has always identified a high risk group. And at the moment, the additional requirement this year to provide flu vaccination to others means that we will be vaccinating about 178,000 more than we would normally. So it is a significant undertaking locally. The total size of the population that would be eligible for flu vaccination locally would be 489,000. We expect, because we don't always get a full uptake of that, to be vaccinating around 380,000 people. So it is a significant undertaking locally. Those that have been added to the list this year, so are children in school year 7, the household members of people who were on the previous shielded list, and then residents aged between 50 and 64. And that's on top of the universal programme, which includes the childhood flu programme, people aged 65 and over, pregnant women, people with certain long-term conditions such as kidney disease, asthma, heart disease. People will always know if they are part of that long-term condition cohort, because they will be contacted by their general practitioner. Informal and formal carers, frontline health and social care workers, children aged over 6 months with a long-term condition, and then the children's flu programme covers children aged 2 and 3 and those in primary school. So you can see with the addition of those 3 larger groups, it is going to be a large number of people that are eligible. At the moment, there are some concerns nationally about the availability of the flu vaccine, and therefore what we have done is make sure that we've got a priority list locally so that we can obviously vaccinate those in order of the level of their risk should they actually contract the flu. So at the moment, it's, as I said, sorry, I can give you exact numbers, additional 176,300 vaccines will be required to fulfill that additional cohort requirement. At the moment, we've got a multi-agency programme of work, and thank you again to all of the partners who have played into this. So the Northamptonshire STP Flu and COVID Immunisation Group is made up of primary care, secondary care, our community healthcare trust, public health, pharmacies, and then the social care and third sector. And basically they're coming together to make sure that we've got a number of different delivery mechanisms. So usually occupational health vaccinate their frontline healthcare workers and social care workers. The school nursing service obviously vaccinates school children. GPs tend to do children aged 2 to 3, high risk groups, so those are with those with long-term conditions, the wider population aged 65 over, and pregnant women. And then this, we've got an arrangement locally that the acute and community trusts and private healthcare providers and community pharmacies then provide the vaccinations to carers and people aged 65 plus if they choose to have it done in the community. Again, pregnant women can choose to have it done in the community. And then people with long-term conditions, again, have the option to be vaccinated within the trust as well. So this year as well, we're looking at making sure that we can stand up, if required, mobile vaccination units. Some of those will be affiliated with GP practices, others will be more affiliated with a county-wide programme of work. And again, making sure that we've got things like roving vaccination vehicles. So they're all options that we're exploring to make sure that we can meet that increased demand this year. Again, our community pharmacies are a real key partner, and quite often the praises of our community pharmacies are not sung enough for the general work they do, particularly around preventative and public health measures like smoking cessation, emergency contraception and things like that. But again, they play a key part in our mass vaccination programmes. So as you can imagine, this will require a significant engagement and communication programme. So again, we'll be using national messaging, but also local messaging to make sure people understand whether they are eligible for a vaccination, at what point they are able to access that, both from a point of view of timings with availability of the vaccine, but also the locations. And again, making sure that people understand if and when the COVID vaccine becomes available, how the two can be delivered together. So, you know, there are concerns about not being given both vaccinations at the same time. So again, once we get clarity around guidelines on that, we'll make sure that those communication lines are clear so that people know when they're eligible for which vaccine and the gaps between the vaccine doses that may be required. Happy to take any questions there.
Thank you very much, Lucy. I've got one question, if I may. It's around the rollout start for the flu vaccine. I'm hearing a lot of people anecdotally telling me, oh, I can't get an appointment. Oh, they're telling me I'm not going to get one for ages, or whatever it is. I have actually booked in for mine next week, so I'm living proof that you can get one when you try hard enough. But it would be good to have some general view around that. And also, of course, you can go to, there are other providers, Boots and other pharmacies, of course, are available as well. So you can do it through that route as well if you're particularly concerned. So something around that would be good. Thank you, Lucy.
So at the moment, locally, vaccine availability isn't a challenge. I know in other areas it is becoming so, and again, we'll keep those communication channels open. At the moment, our GP practices obviously have got their routine lists, and they also are aware of all of those additional cohort patients that they will be required to reach out to. So all of our providers are aware of the numbers that they will need to get through. They will obviously have a way that they need to prioritise and process that. Some GP practices, for example, have sort of Saturday morning vaccination clinics. Obviously with COVID, quite often those are social drop-in sessions. With COVID, those will need to be more in an arranged format. And again, that might be some of the frustrations that people may be experiencing because the format is different this year to ensure people's safety. So all I'd ask is, please do bear with them. The government is very clear and local providers are very clear about who they need to reach out to and when. At the moment, as I said, capacity is going to be limited because of COVID, but vaccination availability doesn't appear to be a local problem, but we will keep you informed if that changes at all.
Thank you very much, and presumably some comms will start around that fairly soon if it hasn't already. Chris.
Has already, yeah.
Yes, I knew it had. Chris Stanborough, over to you, sir.
Thank you, Ian. Just a quick one, Lucy. I've seen a report elsewhere about an area that had a drive-through facility for flu vaccines. Is that something we're considering locally at all, do you know?
Yep, so both from a point of view of, I know that individual GP practices are exploring things like drive-through vaccination clinics, and indeed that was part of the negotiation around our Kettering Conference Centre location for the regional testing site, because a GP practice already had that site booked for their drive-through flu vaccine clinics. So we were able to find them another site for their flu vaccine clinics, and obviously able to use that facility because of the size of it for our COVID swabbing service instead. But again, it's one of the programmes that we're looking at, and because we've had the benefit while we've been on the watch list of having military support, we've used the military planners to help us pull together a number of different options for mass vaccination, be that either indoors in large things like leisure centres or drive-through. The one challenge with drive-through that people need to remember is that our weather is not always kind. And obviously it does require people to work outside, but also there is a requirement when people do have a vaccine to obviously remain under observation for a period in case they have a reaction. So again, just making sure that whatever processes we set up, that we set them up in a way that provides the safest way of delivering our vaccines, but drive-through is an option that is on our list of different approaches.
Thank you very much. Thank you, Lucy. I suspect some of that will be picked up in the comms section, which we're coming to very neatly now, in fact. So we're going to come to comms and engagement, and we've got Claire Hughes here. Hi, Claire. If you wouldn't mind giving us an update on that, and you may want to refer to the flu vaccination programme and our comms around that. Thank you, Claire.
Yeah. Okay. Good morning, everyone. Just generally to update, we are continuing our ongoing messages throughout all our channels, supporting everything around COVID. But we're also very conscious, as we've spoken about earlier, about people getting tired of and overfaced with a lot of messages. So we're definitely looking at how we can target where we need to in terms of spikes or flare-ups in levels of positive tests, etc. So we're continuing that, and we're vigilant as well to make sure that we're changing our messaging around and identifying how we can address sort of reaching different audiences, particularly say younger people. So and with that specifically, we've instigated a young person survey, which is still in progress. We've had really good response to that. And that's actually then stretched out into Northampton Borough holding a focus group today, actually, with people to try and get some good feedback from them, how we can better engage and how they'd like to receive their information. So we're working, and we've reached out to say we'd be really interested to see that feedback and understand how we can spread that best practice. We're also on the back of that trying to reach out to Northampton University, again, looking at how we can engage better with the university students, understanding how best to engage with them, what messages resonate, to get our messages across. So in terms of sort of particular areas, that's some work that we're doing. With our sort of BME group, we're also looking county-wide at our ongoing grassroots engagement through environmental health officers and our police community support officers, who are providing intelligence to us on the ground about sort of gaps that they see in communication with hard-to-reach communities. So we're always looking to hear about ways to improve that. We've been talking to some individuals about how we can reach out to those communities, to link up with people who are well networked and have the ear of the group. Again, that's ongoing work, but it just takes a bit of time, but we are doing that. And we're also looking at what other councils are doing as well to pick up best practice there. So we're constantly evolving our communications around that. With regard to the vaccination and vaccination programme, obviously we will be led by sort of national messaging as well, but we're working with our colleagues across the other departments to make sure that as and when we're ready to progress more detailed messages, we will be out there to inform the public across the county. I think that's probably about it. There's, you know, as I say, examples of where we've tried to do different messaging. We launched an animation video about children. That's sort of trying to, again, very quickly, in sort of about a minute and a half, give a very strong visual view rather than a written view about how you might spread unknowingly, probably unwittingly, the virus, and what you can do to avoid that.
Thank you very much, Claire. And can I just say thank you to the comms team who have worked exceptionally hard throughout this whole period to get the messaging out. I think we've all been impressed with the work that the team has done. And I would add that the posters that you put out for the universities, the schools, all our local, you know, and all that has been amazing. Those posters will really make a difference, I think, as well. So thank you from me, and thank you from everybody, I think, for the hard work that you've been doing. Thank you very much.
Sorry, thanks. I actually forgot to add, because I know in the latest update we talked about the posters, but some feedback came to us around sort of trying to help improve, I guess, behaviour around when school drop off and school pick up. So we then looked at putting posters of external posters out in those sites rather than just having them within schools to try and remind parents and just prompt people. So those have also been produced. And again, it's just an evolving feedback circle. We're constantly trying to improve the ways that we do this. So that's another example, really, where good ideas come to fruition and we can move them pretty quickly. They've gone out to.
Yes, I know, and as I say, very impressed. And also the survey that you've done, I know that had about 2,000 responses. I don't know where we're at with that now, because I would expect.
I haven't got a hot off the press figure, I'm afraid, but I know it's still open, and I think it's still tracking quite well. We're still getting good engagement on it. As soon as we've closed that, we'll review. I know that the team are probably looking at it to try and get some base points initial to see if there's anything that can trigger something immediately. But yeah, I think it's been a very good response. And as I said, I think the learnings from that is we may then move into doing different kinds of engagement, given what that feedback says. So we're going to do the same with focus groups and the same with the university students, which should have a good ground base of how to evolve our communications going forward as things obviously become more challenging if they do.
And again, a very good indication of how hard you've worked, because to reach that number of people is quite unusual for our engagement to reach that number of people. So, you know, that data will be invaluable. I know Lucy wants to come in. Lucy.
It was just to absolutely reinforce what you were saying, Ian. The comms team have been brilliant and with very limited resource as well. Catherine Hall, particularly in my team, has just been outstanding and has worked extraordinary hours with extraordinarily good humour under the circumstances, and has produced some absolutely brilliant work. My team have pulled together those posters with regards to schools and university settings, and I've had feedback from the school cell that it's the first time any campaign has had 100% uptake from our schools. So it gives you an idea about how seriously our schools are taking this, but also how effective and how valued the resources are that the comms team are pulling together with support from Public Health England and my team as well. So thank you to everybody who's been involved.
Absolutely.
I'll make sure the whole of the team receive that, because I know that everyone's been working very long hours and very conscientiously to try and do their very best.
Yes, and also that's while trying to do business as usual elsewhere as well, of course. So it's not just, you're not just doing comms on COVID related stuff. You're trying to run business as usual as well. So again, thank you very much for all your hard work. I think that, unless there's any questions, we come to any other business. Lucy, did you have any other business? No, anyone else that wants to raise anything? No, good. Thank you very much, everybody. So the next meetings, we've got a slight change again on times. So we've got, the next one is on the 8th of October at 3. The following one is the 16th of October at 9. Then the 22nd of October at 8:30 and the 29th of October at 3. I hope those times are all okay. I'm going to come back to Lucy. Yes, hi, Lucy.
Sorry, apologies. I do have one piece of any other business. Because at the moment our case rates are, although, as I said, room for improvement, at a point where we're off the watch list. We did want to explore with our providers whether visiting may be allowed whilst we've got a slightly more positive position. So I know that Chief Execs yesterday said that they were happy for me to obviously discuss it in this forum, that they are looking at how they might facilitate COVID secure visiting, both in the acute hospitals but also in our care homes. So again, that will be subject to environmental restrictions, etc. And should we find that our case numbers increase significantly, again, obviously that will have to be risk assessed and reviewed as required. But it's a positive position to be in, but it obviously just reinforces the fact that we need people to continue to behave responsibly if we're to be able to, for things like this, which are so important for people's mental health, to be allowed to reopen. The second thing was, it was to obviously get a view, as we have come off the watch list. These meetings, our terms of reference is actually that we meet monthly. And therefore, I think it's worth us having an offline conversation about how frequently we do meet, bearing in mind that we've got this slightly more positive position. And if we take the opportunity to step these back down to our BAU terms of reference frequency, or whether we obviously continue them on a weekly basis. But I will have a conversation with members offline, and we will obviously make sure that the public remain updated, because we will continue with our weekly press conferences, even if this meeting goes back to its terms of reference monthly frequency.
Thank you very much, Lucy, and you raised some very valid points there. I know from a member's point of view, I think there is a view that we would probably like to keep these reasonably frequently, but we'll discuss that and we can decide. But those meeting dates that I've given you are the ones currently that we have. Should there be any change, of course, we'll let you know. So on that note, I'm looking around to see if anyone's got any points. I will close the meeting. Thank you very much, everyone who came. Thank you, Lucy. Thank you for all your questions. Thank you for the answers. Stay safe, everyone, and see you soon.